So you want to look at your physician's order and see what medication's ordered. Then get the correct medication in its vial. You'll also want to grab some alcohol prep, a syringe, and the size of syringe that you get depends on how much medication you're giving. So we're giving 2 mLs of medication, so we grabbed a 3 ml syringe. You want to need an extra needle to actually administer the medication because you're not going to use the original access device that you attached to the syringe that helped you draw up the medication. Then you want to perform hand hygiene. After you've done that, you want to set up the syringe and attach the vial access device to the needle's adapter if needed, because some may already be prepared. Now you can use different vial access devices to withdraw the medication from the vial. One type of device is just a plain needle with that beveled tip. Another type is a blunt tip fill needle, and this can be used to decrease needle sticks during medication prep. First, what I'm going to do is I'm going to open up this packaging of the needle and I'm going to leave it in there. Then I'm going to open up the packaging of the syringe, and one thing about the syringe that you want to remember is that you only want to touch the plunger phalange and the barrel. You never want to touch the shaft of the plunger or the end of this tip because you can contaminate your syringe. So we're going to take it out and I'm going to hold it at the barrel. Then we're going to attach this on here. So we're just going to open this up and we're going to put our adapter into the end of the needle. And what we're going to do, this is very important, you want to twist it and make sure it's on there very securely, because if not, while you're withdrawing the medication or going to administer it, it can easily become loose and then you're going to have to start all over. Prepare the vial for medication withdrawal. So you first want to flip off the top of the vial if it's present, like this. Then open an alcohol prep pad and I'm going to clean the exposed top of the vial for 30 seconds. And I'm going to scrub it because this is just going to help decrease any contamination. And then after doing this for 30 seconds, you're going to let it completely dry. To do this, we're going to hold our syringe at its barrel, and then we're going to remove the cap and its packaging in one smooth motion. And we're going to keep the cap inside the packaging and just put this in a secure location for when we need it later. And we're ready to instill the air. So we're going to carefully pull on this phalange of the plunger. We're going to pull it back, so you'll be pulling it down, and you're looking at the markings on the syringe. So we're giving 2 mLs of medication, so we're going to pull back at the 2 mark, and you want to make sure that those plunger seal lines up with that 2, and here we have 2 mLs of air. Now to inject air into the vial, I'm going to hold the vial steady on a flat surface with my non-dominant hand, and then I'm going to take my dominant hand and hold the syringe at its barrel. Now, and we want to go in the center of the bullseye. So to do that, I'm going to position the needle at the center of the bullseye at a 45-degree angle with the bevel of the needle up, so it's facing me. And I'm going to apply pressure to the tip, and as the needle begins to penetrate the stopper, I'm going to push down while simultaneously rotating the needle to a 90-degree angle in one smooth motion. Then I'm going to inject the air into the airspace of the vial. Once the air has been injected into the vial, keep the needle access device in the vial. And then invert the vial by using the same hand positions with your non-dominant hand holding the vial and your dominant hand holding the syringe barrel. Once in position, move your fingers down to the plunger phalange, and we're going to pull back until we remove 2 milliliters of medication. So we're looking at the barrel markings to the 2, and we're taking care not to touch the shaft of the plunger, just the plunger phalange, and we're pulling down to 2. Then you want to remove the needle from the vial. And now we're going to remove the needle that we used to withdraw the medication from the vial and apply a new needle to actually administer the medication.